Hello everyone, my name is Schaefer Leber and I'm an FMR1 at Madigan. I'll be giving you a case report talk today on statin therapy in prevention of ovarian cancer-related mortality. I'd like to acknowledge my fellow co-authors, Dr. Kristen Tobin and Dr. Christopher Taylor, as well as the Department of Family Medicine at Madigan Army Medical Center. To start with a quick disclaimer slide, these are my views, not of the DoD. Next, I'll go over a quick background of ovarian cancer. So ovarian cancer is a pretty large, broad topic, but I want us to focus in on more of its primary care importance. We talk about screening in the primary care setting all the time, whether that's diabetes, hypertension, or certain types of malignancy. Colon cancer comes to mind. However, for ovarian cancer, there's not really quite as much of a clear strategy currently. It's a very lethal disease. 5-year survival rate is less than 50%. It's also really a very insidious disease process, as women usually tend to present in advanced disease stages. This is really only worsened by poor screening tests. Current laboratory and ultrasonographic modalities have really not been shown to decrease mortality and have actually not been shown to prevent undue harm either. So how do we currently identify ovarian cancer? Really, it's by symptom detection right now, which unfortunately tends to be fairly nonspecific. These symptoms tend to include vague pelvic pain, vague abdominal pain, bloating, and even bowel habit changes. So unfortunately, for such a type of cancer that is really so lethal and so insidious, there is a significant need for either new screening modalities or prophylactic treatment strategies to help minimize overall all-cause mortality. Luckily, there's really rising evidence in the current literature that supports the use of statin therapy in ovarian cancer patients and may actually even point to a particular role in ovarian cancer prophylaxis. To begin with my case review, I start with a 76-year-old female OB/GYN physician. She presents to the ED after weeks of progressive severe abdominal pain, bloating, early satiety, and firmness in her left lower quadrant. In the emergency department, she gets some imaging done, which reveals, unfortunately, bilateral pelvic masses. She talks with the surgeon and ultimately undergoes surgical resection. Weeks later, pathology indeed does confirm high-grade serous ovarian cancer and carcinosarcoma ovarian cancer as well. She undergoes, subsequently after that, chemotherapy with successful reduction of her disease and is actually stabilized for over 1 year. As part of monitoring for her cancer after that next year, she is found to have increasing tumor burden with her serial imaging and is also found to have increasing CA-125 levels. This all occurs in conjunction with return of her prior symptoms. And then next, throughout that workup, patient does have some life-altering events, needing to take care of her husband and is not able to follow up with her cancer treatments and workup, and ultimately does some reading on her own in the current literature regarding statin therapy and decides to self-prescribe herself 20 milligrams of atorvastatin daily. After just a short, quick 4 weeks, she notices complete resolution of her symptoms. And then at 8 weeks of statin therapy and eventual follow-up, her CA-125 levels had actually decreased to her post-chemotherapy levels. So to start my discussion of the current literature of statin therapy in ovarian cancer, I would like to start by discussing the current approach. So right now, chemotherapy with debulking surgery is the mainstay treatment for improving 5-year survival in ovarian cancer. Overall, there are limited options that exist outside of this that do not lower quality of life afterwards. So in the face of such an aggressive disease, women often face the reality of living with rather than after ovarian cancer. So the question is to be asked is there another option? Well, for this patient, luckily there was. And so it was statin therapy. It was what she trialed for herself, self-prescribed. And as seen as this, in this case, statin therapy provides an alternative treatment and even possibly prevention. Primary care physicians are very attuned to statin therapy. It's a common medication used to prevent cardiovascular disease by minimizing future fatty plaque deposition and is very safe with overall minimal side effects. So moving forward, what is becoming more apparent with statin therapy is its pro-apoptotic and anti-proliferative properties. So to start on that research trend, here's several studies, and I'll go through in chronological order. The first is by Liu et al. In 2009 that established the mechanism of action of statins on ovarian cancer cells in vitro. It specifically showed how statins induce apoptosis and destruction of ovarian cancer cells through increased expression of several proteins, CDC42, RAC1, and GTPase, just to name a few. Interestingly enough, this is also thought to be the mechanism for a common side effect of statins, which is myotoxicity. So one of the earlier studies of this, Chen et al. in 2016, interestingly, they did a retrospective study and did not find any significant difference in overall survival with statin use post-ovarian cancer diagnosis and after chemotherapy. However, it was noted that the study was small in size. Only 60 patients were included. So Chen et al. Prompted another retrospective study, which was much larger size, more about 5,000 patients, and performed in Belgium. This study focused on both pre- and post-diagnostic statin use, showing actually an 18% reduction in ovarian cancer-specific mortality. Later on, a secondary analysis did find a specific survival benefit of pre-diagnostic statin use on post-diagnostic statin users, hinting really at possible preventative or even prophylactic benefit. Then in 2018, an even larger study with actually 19,000 patients across 3 different continents found, again, a significant improvement in overall survival in post-diagnostic statin use specifically, though there was some concern that statin use does benefit people in their survival with its cardiovascular effects. Harding et al. Was another post-diagnostic statin use study that re-demonstrated a significant risk reduction in cancer-related mortality, particularly in the first year after ovarian cancer diagnosis, though this study was limited by the disparity in disease severity between patients in the study. And lastly, and really most importantly, Visvanathan et al. In this last year performed a wide study of over 10,000 patients demonstrating a 40% reduction in mortality in either pre- or post-ovarian cancer diagnosis patients who had undergone a form of statin therapy. Really, our scholarly question for this is, should women at average or high risk for ovarian cancer and those diagnosed with ovarian cancer be placed on a statin? Our conclusion is that ovarian cancer remains one of the most lethal cancers facing women today. Fortunately for any practitioner caring for women, statin therapy for prevention and management of ovarian cancer is an exciting and possible prospect. Now, I'll be free to take any questions if you have any. Thanks.